Peacemaker 360 Peacebuilding platform. I'm Jessica Castoon and I'm your host for today, tuning in live from Canberra as always in Australia. And yesterday we're back by high demand from you, our viewers, for more lively discussions thanks to your responsiveness and engagement in our Peacemaker 360 platform, online and offline. Joining me in today on this call, we have our talented guest speakers, our panelists, and we have Farah on the call. We also have Hannah and Debra. And I'll pass over to our expert panelists for a more formal introduction. A shout out to Christian, the founder of Peacemaker 360 himself, Mr. Peacemaker himself, who is doing the technical broadcasting any live commentary we might have from our audience. So to our viewers, if you have any questions or comments, as you feel, and the questions and share with the audience. For our talk show today, I've divided it into three. The first part will be an introduction to our guest speakers to understand more about who they are and their current work in the field of peace building and human rights. In the second segment, we'll be addressing of today's hot topic, the UN observed Day on Happiness. Did I say happiness? Yes, I did. Okay, which is coming up actually on the 20th of March, so we're a bit behind with that. Nevertheless, we're still in the mode of celebrations. In the third segment, we'll narrow our focus, our discussion to explore more about mental health as an essential component to well-being. The estimated time frame of this call will be 45 to 50 minutes, depending on the content in our panelists. So go ahead, make yourself a cup of tea or grab yourself a coffee and sit back and enjoy the live talk today. Now, without further ado, let's head over to our speakers and hopefully we can hear you clearly. And please, each of you respectfully introduce to our viewers a little bit about yourself, where you're currently calling in from, your country of origins, and the work that you're currently engaged in. Over to you, Farah.
Okay, first of all, hi everyone. My name is Farah, it means joy. And I'm the regional media officer for the United Nations Migration Agency for the Middle East and North Africa. I'd like to think that this is what I do for the humanitarian, in the humanitarian field and peace building. But I also try to be as much as possible active on climate issues. Speaking about happiness is a very personal matter for me because I have an eating disorder and I've discovered it quite late in my life. And that's how I started inquiring more about the subject of what is happiness. And yeah, so nice to meet you all.
Thank you so much for being on this call, Farah, and for sharing that delicately with us. And Hannah, over to you.
Farah, thank you for sharing. It's so nice to be on the call with each of you. Special thanks to Jessica and Christian for the invitation to be here. My name is Hannah Simon Gerard. I am a nurse clinician and a doctoral candidate at University of Massachusetts Medical School in Northeastern United States, from where I'm calling in. And I'm also a public health strategist with a history of young career in peace building and trauma-informed care. And presently, I help facilitate a substance use disorder clinic for patients in primary care at what's called a federally qualified health center, so an FQHC that serves the medically underserved.
Great, thank you for that introduction, Hannah. And over to you, Debra.
Hello, everyone. My name is Debra Norwood, and I'm an attorney, peace builder. I'm also a resilience trainer who is a certified brain health coach, as well as 2 other certifications I'm kind of proud of. I'm a part of the Association for Applied and Therapeutic Humor. So I'm in level 2 Humor Academy right now, ready to be going on to level 3, which is going to be a fun time discussing humor for peace and exploring a little bit about implicit bias that sometimes occurs in humor. So it's going to be a very interesting, I think, topic for me to be exploring for my last year in humor studies. I'm also a certified laughter leader with the World Laughter Tour. So I take laughter and humor rather seriously, and I've actually created a conflict resolution model called Humor for Peace, because I believe that humor is one way in which we can enter into people's hearts and build trust. As for talking about private matters of our own, I'm a mother who has raised 7 children, 3 of which are special needs. So my interest in mental health and mental health awareness came from 2 sides of the coin. One, as a peace builder mediator and interested in brain studies, and secondly, as a mother. So I've come at this from a very heart-based point of view.
Great. Thank you so much, Debra, for sharing both your professional and personal experience with the viewers. And to all our audience today, you can see we have a highly talented panelists, group of empowered female on this call, which is amazing. So let's bring the 20th of March, which is the World International Day on Happiness and focuses on the importance of well-being. The UN Day has been commemorated since 2013 for recognizing happiness in the lives of people around the world, and it was endorsed and adopted in Resolution 66/281 by 193 states. Jamie Ilian, the founder of Capitalism, was instrumental to the recognition of this day, advocating for governments to prioritize happiness as a human right and a goal for public policy. Ilian himself advocated for a new economic paradigm which places happiness and freedom at the center of human development and all life. We then had the UN General Assembly that acknowledged how the unsustainable patterns of production and consumption can impede sustainable development. And they recognized the need for a more inclusive, equitable, and balanced approach to economic growth that promotes sustainable development, poverty eradication, happiness, and well-being of all peoples. Now, to our panelists, do you personally believe that happiness is a fundamental human right? Why or why not? Who would like to go first?
I'm sorry, Jessica, the voice broke a little bit. Can you repeat the question?
Yes, of course. Do you personally believe that happiness is a fundamental human right? Why or why not? Who would like to go first?
I guess I can begin.
Deborah, please go ahead.
I think that it's very exciting that we are looking at well-being and happiness as a way of measuring, as an index of measurement for not only people's understanding of what is subjective happiness, that ha-ha happiness, but also what is a resilient community. So in that sense, when we talk about well-being as opposed to happiness, it makes a little bit more sense to understand the word happiness in a larger perspective. So I think what these happiness indexes are really doing is not just measuring what we think is funny and happy, but also what is well-being. And I believe that we do have a fundamental right to dignity, human dignity. Human dignity is something that includes the ability to be able to express yourself, to be able to have your basic needs met. And by basic, I mean to be able to eat, to be able to survive, and to be able to provide for your family. So I think if we were to use that as a fundamental basis on what happiness is, then yes, it is absolutely a human right that we should all fight for. And I would call it human dignity.
Great. Thanks for sharing that, Deborah. Hannah, any comments from you?
Yeah, I would echo some of that. I know that the report measures a variety of different variables, several of which Deborah has spoken to in terms of the sort of innate rights that we have as human beings, and what does it mean sort of to have this cumulative, the totality of our happiness and our well-being. And some of those variables are related to socioeconomic status, social support, just freedom from corruption in our government, enjoying the life expectancy that we think is appropriate based on what we know the human being able to achieve for life expectancy, so on and so forth, and ability to be free to make choices for ourselves. And so one thing that I find particularly compelling and really important about how we define happiness in this way is specific to the discussion on generosity and sort of how do we pour into one another's lives, and what does that mean for how we enjoy life and how we also help to alleviate suffering from within ourselves and amongst one another in community. And so I absolutely agree that I think happiness is a fundamental human right, and that one of the ways that we get to that place is through the alleviating of suffering from within ourselves and without.
I really like both of your interventions. I think that the definition itself of happiness and our angle of how we're viewing it is how it makes it a fundamental human right. I think happiness is really our nature, our present moment, our being itself. This is who we are. Happiness is exactly what you said, Hannah, about alleviating the suffering of others, but also our own suffering. And it's not a right that can be given. It's rather really taking consciousness of everything that's coming and pouring on us from the marketing world, from the outside world, and saying, at least, I'm creating a safe zone for myself and then for other people in my circle or community or bigger world. I think the more we're going to go into the conversation, I'll be able to elaborate more on how I see it also from a very personal, center-based perspective.
Thank you. So it sounds like there's consensus from our panelists that happiness is a fundamental human right, and you all underpin the importance of well-being and how happiness and well-being is tied to community in that sense. Now, moving on to the second question, which I found very interesting via research. Forbes ranked the 10 happiest countries in the world for 2018 as follows. Number 1, Finland. Second, followed by that, was Norway. The third nation was Denmark. Fourth was Iceland. Fifth was Switzerland. 6, the Netherlands. 7, Canada. 8, New Zealand. 9, Sweden. And 10, Australia. Now, what does it say when you have the top 5 nations being from Scandinavia? What's actually going on in those countries with their government or welfare systems or values that make them overall happier societies compared to the rest of the nations? And how does that compare to the happiness pedometer or state in your particular nation? To Farah.
I'm interested first in knowing what's the basis of studying this happiness. Are we speaking about putting hearts and lovely posts on Facebook, or are we saying the possibility of purchasing some brands, or how much of family members do we have, the ability to carry children or to live longer? What is exactly the index for this? This is the first question that I put on the side. The second comment. I've visited several of these Scandinavian countries, and it's been a great, amazing experience. Although personally, I really need sun to be happy, but that's also all about personal experiences. I would argue and say that I think happiness, if seen from other angles as well, can be seen in India, can be seen in Egypt, in one of the most crowded, challenging environments. But if we're speaking about the normal social and economic norms, then yes, Scandinavian countries have this gender equality, fair employment, youth employment, all of these good policies that would make a material happiness possible.
Okay, thank you for sharing that, Farah. And just on the point of index, if either of the other two panelists would like to elaborate in your experience, have you come across how these studies measure happiness and well-being, or what are the
I think we're looking at a foundation in positive psychology that talks about the whole person, not just looking at the subjective idea of what makes a person internally happy or unhappy, but what makes an entire person, as well as their societal environment, a place where they can feel strong, resilient, and able to fulfill whatever goals they might have for themselves. So they use a model called the PERMA model, which is positive emotions, engagement, if there's societal engagement, interaction with one another, relationships that are healthy, whether there's meaning and purpose that can be found, and then what kind of accomplishments can occur within that society. They look at those foundations. They also look that the basic needs are met, because we cannot have people dying of starvation or being in a high conflict area where they're being tortured and human rights have been totally eliminated. Even though, yes, there will be some person in all of these situations who will be resilient and will be able to find happiness within, as Farah so beautifully said. The index is not going to measure that as a country that would be considered to be a whole happiness and well-being nation. In our country, in the United States, where I am, we've actually dropped down in the index, and we actually have a higher rate of suicide and addiction than we did in the previous indexes. So we're dropping, and we've been dropping since 2015. So that's showing that our society is not creating a sustainable environment for our people to remain resilient in the face of adversity.
Hannah?
Yeah, I would respond to that too, representing the Northeast USA, and just a thought that comes to mind, in particular, being a nurse clinician that works specifically in substance use disorders, and kind of comparing some of the public health programming that we see in Scandinavia that helps influence this overall sense of well-being and safety within your own country, and social cohesion even, and support, and how we arguably lack that on quite a great scale here in our country. And in particular for those that are perhaps the most like cumulatively disadvantaged. Case in are a couple of researchers that recently published a paper on this, and then another follow-up in 2015, I think, and then again in 2017, that talked about mortality and morbidity in the 21st century in the United States of America, and really looked hard at why are we seeing this many what they call deaths of despair. And they talked about deaths of despair in terms of accidental or intentional death by alcohol, by illicit drugs, and by suicide. And that has majorly affected, especially since the 1990s to the early thousands, the teens, especially for those that are in midlife. And for those that have less than a college degree and are white, non-Hispanic men and women in our country. And so I find that paper particularly compelling when we talk about, what do we not have compared to Scandinavia, and what are a lot of the complicated reasons for which we don't necessarily have a really insulating, protective social norm around well-being and happiness here. And I think that gets at a few of those factors. And I think just the language around deaths of despair is really important. And so for me, to respond to your other question around maybe what are we doing, or maybe what do we see happening? I think that efforts like those that Debra mentioned that she does, and that I probably do with patients in our setting, is looking at how can we be resilient to those vulnerabilities, and how can we actually promote more sociality here to protect one another from that kind of internal and communal despair that we see happening. And there's lots of different approaches to reach that kind of goal.
And Jessica, I would add that part of because I mentioned the positive psychology basis for resilience, but also part of that is the economic disparity. There is a measurement of poverty and inequality that occurs, as well. So that's how they measure the gross national happiness of a country, is also measuring the type of inequality and poverty, and also what social systems are there to help people with any kind of inequality that might occur. So I would say the Scandinavian countries have definitely worked very hard on those social system supports for preventing major inequalities.
Thank you. Thank you to all of you for your very strong remarks, especially when it came to the indicators you mentioned, how economic disparity psychology are relevant indicators that the nations are looking to. And mainly, I think Debra highlighted the importance of having your basic needs met in society. So Maslow's hierarchy, I suppose this really draws a distinction between those developed and underdeveloped nations. Okay, so I think we'll move on to our next question, which I think Farah touched base on. In your particular country context, is the mindset of happiness still tied to consumption, or is there becoming a shift to the focus on sustainable well-being? And how has positive psychology or mindset development progressed among the youth within the recent years in your particular country context? Who would like to go?
I guess I would comment initially by saying that I think, as an N of one, very anecdotally, what I can observe in my local context is that there is sort of this thirst and this rebellion against consumerism, but somehow it's the shroud that overtakes our social norms quite a bit here. And there are some rebirths, if you will, or revitalization of different approaches like mindfulness and gratitude meditation, and sort of rethinking being fully present and inhabiting with gratitude where you are, as opposed to comparing yourself to where you wish you were or think you should be, etc. And I see a lot of that tension in my patients, and how it causes considerable illness. And that some of those approaches that I mentioned, like mindfulness techniques, as one example, are really, really helpful strategies to reorient people and to really promote well-being in a profound and simple way.
Thanks, Hannah. So Hannah mentioned gratitude meditation and mindfulness techniques as keys or strategies to promote happiness and well-being. What do our other guests have additionally to say about that?
I really like Hannah's point so much, because it reminds me of a sentence that Eckhart Tolle, the author of The Power of Now, a very powerful book that I strongly encourage everyone who's watching to go and check it. He says that somehow in our age now there is a global movement of people who are focused more on the present moment, on meditation, on gratitude, on being fully aware of their current of the current moment, because that's all what's there really. The past is the past, the future is just a brain projection of what can be, and this is how mental illnesses, of course in his vision and in his explications, this is how they're born, and this is how they grow. Being present, meditating is definitely a growing method. I can tell you that in Lebanon, particularly where I'm from, but also in the Middle East and North Africa region, a lot of young people are finding this the solution, the absolute solution to their unhappiness. The region, the Middle East and North Africa, is going through so much turmoil, so much wars and conflicts and climate change. It's really, if you think about it with the brain, it's really unlivable. So how are we doing as young adults, or as adults, or as population as a whole? A lot of people are finding answers in meditation, and no longer in the traditional religions in its traditional forms. Yes, on positive psychology, I wouldn't know. I'm hoping Debra can tell us a little bit more about this. But on a personal community awareness of this, of meditation, of mindfulness, there is an impressive growth of knowledge about this.
I agree with I agree with Farah. There's an amazing amount of disruption and disruptive innovation that's going on all over, structural changes all over the world. And I think that people are searching for answers. I look at things from a brain health perspective because I'm a brain health coach. So I also look at the neuroscience behind some of this. And, you know, there is a neurological basis for mindfulness, meditation, and prayer. I would not completely discount the value of religion in searching for meaning and happiness, because that is still a very strong fundamental way in which people are finding meaning in other parts of the world. But I would say that we really do have a necessity to teach young people, especially in our peace building for youth programs in the United States that we do with CourageKeepers. We talk a lot about looking at something being medical, not moral, and something being not necessarily, it's chemical, not character. I think that is where we have to go into a little bit of the scientific side of depression, anxiety, and addiction. We have to recognize that that does exist, but that on the other side, what Farah is saying and what Hannah is bringing up is that there are studies that show that the brain heals tremendously with gratitude, with meditation, with prayer, and especially with focusing on gratitude and forgiveness, which is what most of the reconciliation work that peace builders do is all about.
Great. Thank you, Debra and Farah and Hannah, for sharing those insights. So if I can just repeat the important points of how you linked well-being to gratitude and really capturing that state of mindfulness, being present and maintaining that practice. Farah also mentioned that in the Middle East and broadly in those nations that are faced with conflict, you have a lot of people really making the most of meditation and mindfulness to stay in the present and tame the mind by not taking it to the past or to the future, for that matter. And Debra, you specifically said that meditation is tied, and studies have shown the neuroscience behind it. So I'd just like to expand a little bit more on that. From my understanding, and I've dealt with a lot of patients who've had mental health disorders. From my understanding, there's something that changes in the brain matter. It actually changes, the green and the white matter changes after a person has experienced trauma or gone through a really bad mental health conditions without labeling it. So say PTSD. So my question to you is, have those studies, or from your experience, have you seen consistent mindfulness or meditation result in the healing of that matter in the brain?
Are you asking? Well, yes. I mean, if you're asking me, I would definitely say that there are studies there's brain spect analysis of the brain that shows, first of all, you can determine if someone's having PTSD through a brain spect. In the past, people didn't know if you could really determine it, but we've been seeing that. The brain spect analysis is also showing that there is a massive change. The whole brain is used completely during meditation, and it doesn't matter what time of meditation, but it does matter what kind of meditation. So the meditations that have to do with loving kindness and gratitude definitely fill the brain with more blood flow, and there's a little bit more attention to to focus. It helps a lot with focus in the prefrontal cortex. I think the other thing that Farah mentioned about conflict, I think she mentioned being present in a place of conflict. I don't know if it was Christian or who put something up about the suicide rates in Ireland being extremely high, but we saw a little banner come through. And in any area where there's high conflict, then we're going to have a totally different idea of how to deal with the brain. And the brain under conflict, the brain in violence, the brain with anger, and the brain with hatred really needs to be flooded with forgiveness and gratitude, And that's a very difficult thing that peace builders are going to have to really understand. What are the origins of hate and anger in the brain? And how can we, if we don't have a doctor available, how can we treat a person? So that's where my heart goes out to all the peace builders in the field who are dealing in a high conflict situation and are not going to be able to just give an antidepressant to a human being. They're going to have to give them something more physically able to relate to their thoughts and how they are going to do cognitive behavioral therapy to help themselves. And I think that's what Hannah and Farah are talking about.
Great. Thank you for sharing that insight, Deborah. So as we know, a lot of our viewers on this call are peacemakers themselves or peace builders who have to some extent stretched their mental capacity working in some form of conflict. So I guess one of the tools that we can take from or tips to take from the call is to really focus on cognitive behavioral strategies such as mindfulness, but more specifically loving kindness meditation. As I understand, forgiveness and gratitude types of meditation will really work on addressing that prefrontal cortex and really put you at a state where you can continue and persevere. So I think we've already moved into our next topic, our third segment, which was on mental health being an essential component to well-being. I would just like to go back to the point earlier. I know we were talking about techniques and tools, but just to hear in what's happening in your particular countries, are there any specific organizations that you can name that are mobilizing happiness and well-being in your country, and they're really inspiring the masses and governments to shift that focus, particularly within public policy?
Jessica, you might know this about Lebanon and about the region, but while there's a growing interest among young people and the general public in mindfulness, awareness, whatever you want to call it, there's not really any non-governmental body that's doing this kind of work, at least not yet. Not in policies, but there are a lot of institutions to gather believers, to meditate together, to do mandala activities, even in the field. A lot of these organizations go to the field and provide the support. I still haven't seen anything on the policy level.
Okay, so it's more on the periphery and not so on the policy level in the Middle Eastern context, as you say, Farah. What about
as far as I know, yeah.
in Debra? Sorry, I missed that. Sorry, Farah.
No, yes, correct.
And Hannah and Debra, do you have any insights to add on that?
So I guess one national scale effort that comes to mind, at least in terms of addressing policy for how we implement best practices for individual and community level resilience, would be our Substance Abuse Mental Health Services Administration, SAMHSA, who is sort of the national leader for distributing, supporting, evolving research in this regard, and then also, of course, empowering organizations from the grassroots level all the way up through the public sector at the population health level for how we do our programming and how we outreach to people, as one example. And then in particular within the Northeast, I think we have a couple leaders in the field, both of mindfulness and then in terms of trauma-informed care, respectively. We have so John Cabot-Zinn, who is a internationally well known for mindfulness himself. Started a mindfulness institute here in central Massachusetts. It's actually affiliated with the University of Massachusetts medical school and health system. And then in the Boston area, the Justice Resource Institute Trauma Center, which is led by Dr. Bessel van der Kolk, who's a very well-known researcher and psychiatrist in the field of trauma-informed care. And I think their work on both mindfulness and then also on yoga as emerging best practices. So to Debra's earlier point on how do we do this in the absence of pharmacotherapy is a brilliant mention. And I think that the tools that they're bringing forward to show in more robust and larger scale studies the impact of mindfulness and gratitude and self-forgiveness and self-compassion, and then extending that toward our neighbors and our community. And then in yoga, as well as another manifestation of that, another embodiment of that is helping us access resources for community members that maybe aren't going to have direct access to pharmacotherapy. And I would argue, and the research would argue as well, I think, and support this idea that even in the presence of pharmacotherapies, like antidepressants and anti-anxiety medications, for example, they're really important and they're very useful and important to have when you have access to them, to be able to use them when they're medically indicated, but they're not a special magic pill in the same way that mindfulness and yoga and gratitude and meditation and prayer each unto themselves are not a magic bullet either, right? But when you are using all these tools together, I think that they're so nourishing to the person and the spirit and the community. So I think they work well in complement, and then they also work well and are fabulous tools as standalone.
Debra?
I agree with both Hannah and Farah. I really love what they were mentioning about being able to be in the field and be able to help people in a moment of need. I can speak with regards to systems and system changes. I can speak mostly about the legal system in the United States. I'm part of an integrative and holistic movement. Integrative lawyers are around the world, where we've got a wonderful leader named J. Kim Wright, who's kind of the grandmother, I guess, of the integrative and transformative law movement that's allowing for system changes. And so we're talking about changing the criminal court systems, decriminalizing mental health. We do have some mental health courts that are cropping up around the country. We have restorative justice courts that are cropping up. Still a very slow progress. And then within the health of the legal profession itself, I work as a resilience trainer, not only for youth, but also within our legal community. We are in some areas, our fourth leading cause of death among lawyers is suicide. And so we're working very hard on finding holistic and integrative measures that will help people that are in the justice system. And I think that all of these movements together help those who are in the field right now as peace agents in areas of conflict. We've got some wonderful things that are happening with transforming violent extremism, with the restorative justice programs, forgiveness programs. And I think that's all part of that trend of looking at the heart, having a heart-based practice and learning about people and looking at them as a whole, not as a patient, a client, a terrorist, a bad human being. And I think that's the probably most healing change that we possibly can find in peace building today, is that there are those light workers, and I call them light workers, that are working with light, looking at people as beautiful, regardless of their background.
Great. Thank you for that, Deborah, and also for sharing that concept of light workers. And perhaps we have a lot of light workers who are working on the field and also within the legal systems. I can also share in Australia, we do have mental health courts that are popping up, but more so on the restorative justice side. And the focus has been on building the resilience of lawyers. And really bringing that awareness that, hey, you have a lot of lawyers right now who are experiencing a lot of mental health concerns because of the ongoing face-to-face coaching and counseling, and the need to maintain their own well-being for them in order to be able to give to their clients more efficiently and help them. Okay, so I'm really cautious of the time. I think we had Darren, who was supposed to join us in on this call today. Perhaps we can schedule another talk show with Darren and other panelists to join in on this topic. As I'm cautious of the time, we still have 5 more minutes remaining. So why don't we go to the point of can mental illness be prevented within a community? Can it be prevented? And does it pass through generation? What strategies can be used to mitigate wounded communities? I know that's a loaded question, so I'll just repeat the part of it. Can mental illness be prevented within a particular community? And does it pass through generations?
So I guess I'll try to respond briefly to this because it's very provocative, and I think these are important questions. And I would posit that we have so much more that we still need to study and understand to discern what is protective about whether mental illness, I'll use the terminology, is expressed as in genetically, or is not. And so I think that there's still limited information that we really fully understand about that. However, that being said, what we do know is that the expression of mental illness is part genetic, part environment, and connected with environment are sort of lived experiences. And so we know from research that when we can build in protective factors, like some of the variables that we talked about earlier on in the call, in terms of Maslow's hierarchy of needs, that's going to be protective against mental illness for certain people that are perhaps more vulnerable. And so when I think about these problems in my particular setting as a clinician, where we have medically underserved folks that are usually coming from socioeconomic disadvantage, and perhaps generations of communal, like historical trauma legacy within their communities or perpetrated onto their communities. I think some of the best ways that we can prevent that expression of mental illness is through providing adequate social support, providing that those basic socioeconomic needs are met, and creating safety publicly, right? So creating the absence of violence. These are some of the ways that we get at that. But I do think that it's something that we don't fully understand, and that's a hard question to answer fully.
Farah, do you have anything to add?
I can definitely relate to what Hannah is saying because in the field, particularly with migrants who are fleeing wars or climate change or different situations, the activities that we do to try to create a secure environment, particularly for the children, are so many. Some of them are directly with psychologists, but some of them go through art therapy and different psychosocial support activities. These remain preventive, responsive approaches. But then again, mental disorders, mental illnesses, they can have different roots, different causes, and they can even develop at different stages of life. It's very interesting, the question on the hereditary part of it. I have a certain problem within my own family, and I've always wondered actively in my brain, will I ever have it, or do I have it? And it's interesting. I'd really like to know what the science says about this. However, I also think that looking at it or speaking or saying that mental illnesses can be hereditary can also stigmatize or might stigmatize members of the family. So yeah, I'm not sure what Debra would tell us about this, but yeah, it's very interesting to know.
I mean, I
Debra,
love
how can you respond to what Farah said?
I just love. I'm in love with both these ladies. I wish I could just take them home with me and have classes. Our youth programs have them be present, because that's what we need. We need people who are willing to talk about mental health awareness, have a conversation without stigma attached to mental health. We have to be brave. In the suicide awareness and prevention programs that I do, as I said, I inject a lot of humor, because I find sometimes humor opens the door, humor and laughter. So I am a compassionate clown that brings up very serious subjects. I take these subjects very seriously. So we have a little fun, and then we talk about suicide. And what we use is a program called QPR. And I believe everybody who works in peace building should at least be trained a little bit in QPR. And that is how to question someone when they're depressed, how to persuade them not to hurt themselves, and then immediately refer them to some help. That is not requiring you to be a mental health professional. That's requiring you to be an empath, to have feelings, to understand. Another thing that Farah brought up was safe spaces. In the peace building, in the Youth for Peace program that the UN is, on Youth Day, one of the themes for Youth Day was how do we build safe spaces to talk about what's going on among the youth today. In the United States, I'm working with a minority group that is under attack right now, and that is the Dreamers and the Hispanic group. Hispanic males from 14 to 24 are at higher risk of suicide than they ever have been before. Of course, youth in general in the United States is at higher risk than ever before for suicide and addiction. So, one, reduce the stigma. Two, increase safe spaces. And then three, definitely become capacitated, learn how to talk about mental health issues in a way in which we can provide happiness and health to others. And that is by eliminating all the myths and all of the problems that happen when we kind of create a stigma around anyone that has a mental health issue. So I don't know how you categorize that third category. Hannah might know how to say that better. But one, reduce the stigma. Two, create safe spaces. And then three, get some knowledge, folks. If you're going to be working around people that are miserable and unhappy and have had some terrible things happen to them, then learn how to build up the empathy, the compassion, and the conversation with them so that you can connect. Because all of this is about connecting, isn't it? Connecting so we can save lives.
Yeah, thanks, Debra, for sharing that empathy tool, if you will, that you just mentioned, QPR. And I think that's really timely in this day and age where a lot of us are looking at courses, or what can you do to upskill yourself to really deal with people with mental health conditions. But basically what you're saying, QPR can be used by anyone working with survivors of mental health conditions. And basically it's about questioning a person gently, persuading them and referring them to a proper avenue or proper practitioner or person or organization.
It's a methodology. You can go to QPR. I think it's .org, it may be .com, but it's a method to talk to people, and it's for people who are not mental health professionals, and I recommend it for all peace builders.
Mm-hmm. And I would love to echo and add on to that as well, and shout out to Australia, actually, Jessica, because mental health first aid first became another program, a similar approach to QPR. In Australia, we have Australia to thank, I think, for the proliferation of that as an approach, which is also does not require that you're a clinician to use that approach too, and it is in an overwhelming number of countries now as a basic approach to essentially give first aid from the mental health perspective to anybody that you encounter. So in the same way, for those of us working in conflict zones or in communities that are experiencing structural violence, physical violence, all these sorts of varieties of pain and suffering, that's another way that we can help to alleviate that by gaining some skills around how to identify it, and then how to provide a safe space and reduce the negative health outcomes that can erupt as a result of surviving things like this. So mental health first aid.
Yeah, Hannah, you rightly mentioned we do have several courses. One of them is known as Assist Training. It's for assist suicide intervention and prevention. So it really sort of goes into the QPR methodology. But yeah, we have a lot of trainings in Australia, and luckily we have been taking the lead. Farah, do you have any final closing remarks before we end the call today?
Yes, there is an amazing app. And I'm sorry if it's an advertisement, but I think it's super helpful. It's called Calm. You might know about it. You might like it or not, but it's been an amazing experience. It helps calming really a lot of anxiety, stressful situation. The talk was amazing. Thanks a lot for everything you shared. I learned a lot today. I think I'll go and study them tomorrow when I wake up. And thanks a lot.
Thank you, Farah. And I think we just lost Hannah. Thank you, Hannah, for your time. Thank you, Farah, and thank you, Debra. Debra, did you have any closing remarks before we go offline?
I'm just extremely grateful to you, Jessica, and to Christian and all of those who organized this wonderful mental health event. And I just thank you so much for inviting me.
Thank you. We feel really blessed to have you on this call today, Debra and Farah. And Hannah, are you still there before we terminate the call officially? Looks like Hannah disappeared. All right. Well, I'd just like to take this time again to thank the three of you, and to our viewers. Farah just mentioned a great tool. It's called Calm, and I will second that with Insight Timer, a great app as well for mindfulness. So thank you for being here on this call, and we look forward to having more live talk series. And I noticed a lot of our viewers had some commentary, but we've exceeded. We'll get back to your comments at a later call. Oh, Hannah, you're still there. Did you have any closing remarks?
I just wanted to thank everyone so very much for all the wisdom and heart that you've shared together tonight. Thank you so much to our viewers for taking an interest and for accompanying us on this work that each of us does. And thank you very much for the invitation.
Thank you all for your hard work, and keep at it. Thank you, and goodbye to everyone.